Hello again, everybody. This is Wendy Myeroff, the business co-anchor of Partners in Health and Biz. Normally, we have a very chipper opening created by my partner and real audio expert, Gail Dixon, who's our wellness co-anchor. But we have a special show today. First of all, I will apologize. I was supposed to have two brilliant guests on today, and we recorded the show. It's Tracy Duberman and Robert Sachs, who came on board and in a half hour gave brilliant advice from their book and from their backgrounds. The book is called From Competition to Collaboration, and that was scheduled for this morning's show. But after I heard about the tragedy in New Zealand, I decided it was time to put together a show offering insights on what the healthcare industry really needs to be doing to fight terrorism. There's a lot, of course, we can't do. Health professionals and hospitals are not FBI agents, and they shouldn't be. But what can they do to get ready for these horrible attacks? And what is going on in post-trauma care? If you're getting ready to shut down, stay with us, because if you think this is already being taken care of, that's exactly, I will give you a hint about when you hear Tracy and Bob talk about from competition to collaboration. You'll hear why what we have now is not working. A lot of brilliant trauma issues are put together. A lot of anti-terrorism programs in hospitals and elsewhere are being put together. And yet, because of the lack of collaboration, we're not accomplishing everything we really need to do. So I'll tell you a bit more about that in a few minutes. Again, I apologize to Tracy and Bob about not getting the from competition to collaboration show ready for today, but here's the reporting from what I can give you quickly on healthcare and the terrorism age. If you've been hibernating and didn't come out despite wonderful temperatures, for example, as I record this yesterday in Baltimore, there was a 70-degree, gorgeous spring-like day, but a white supremacist over in New Zealand attacked two mosques yesterday, and 49 people are dead. That's all the info I had as I was prepping this show late last night, and from what I've been able to check before I sat down to re-record this, that's confirmed. 49 people, and they said there was only one attacker, but the bottom line is this was a totally anti-Muslim event. It was totally racist, and the manifesto touted white supremacy. While most experts point out how terrorism goes back throughout history, many times it wasn't really revealed till after Hitler, when the Holocaust camps were uncovered. I want to remind folks, and don't take this in a bad way, while 6 million Jews are always mentioned as being destroyed, we should remember all of those terminated by the Nazis, and that comes to 11 million people, including gays, Catholics, and the physically or mentally disabled. Of course, many terrorists or the terrorist-minded insist the Holocaust never happened. And even if they believe it happened, there are those who are cheering and saying it needs to happen again to go even further. Of course, many of us, including yours truly, lived through 9/11. Sadly, that's what's really awakened any kind of terrorism planning around the world. But we can't just wait for political leaders. While it's fortunate that in many countries, at least those that are free, and especially those in the West, although it just happened in New Zealand, those leaders condemn terrorism. Unfortunately, we can't claim that in the U.S. Our president denied Charlottesville was a racist issue. He said, and I quote, "You have some very bad people in that group," referring to white supremacists, but then he went on to say, quote, "But you also had people that were very fine people on both sides." Fine people on both sides was not something people were fond of hearing. Then there was his response to the horror in New Zealand, and he just said yesterday, and I quote, "I think it's a small group of people," when referring to the question, did he believe white supremacy was really a big issue. "I think it's a small group of people," President Trump said. Well, once again, he's not staying informed, or he's just denying things, because on the news last night, as I was prepping my presentation, one expert noted that over 73% of terrorist attacks are white supremacists. On a different show, another expert used this phrase: there is a white nationalism international. Putting politics aside, though, whoever does it, whatever kind of terrorist attack it is, whether it's on immigrants, whether it's on gays, whether it's on, people who aren't tall enough, whatever the nonsensical delusion is, doctors, hospitals, and others in healthcare cannot just wait to be prepped for terrorism. As I said, I was still home in New York City during 9/11. I was working on a New York Times project that had to be rescheduled. I didn't know where my husband was most of the day until 2 p.m. His only note had said I was going downtown. I didn't know he was in downtown Brooklyn and going to have to travel on a bad knee, this veteran with no left knee anymore, just two bones clicking against each other, had to walk 10.5 miles home. People like hubby didn't need immediate treatment. Other people were not in the dangers that the major hospitals were wonderfully prepped to receive. So yes, they could do splints and they did whatever other things needed to be done, but it wasn't the kind of mass cow, ripped open hearts and other things that they were expecting. Just everybody died. At least a lot of politicians thought everybody died. A lot of health pros thought everybody died. But in no way was New York City ready for the long-term health issues. And we're seeing it more and more now. Here we are almost 20 years later, and we have all the first responders suffering side effects. There was a heck of a fight to get dollars to get them extra health care beyond whatever their unions paid for, especially for long-term effects. Yet there's almost no money left in what was put aside to care for them. As things keep creeping up, the healthcare industry and, of course, the politicians are not truly put together to care for these first responders. Imagine as regular aging issues join into whatever side effects they had from their exposure. Just regular issues. Maybe they've gained weight and they've got new high cholesterol or high blood pressure issues. Maybe they've tried to stay fit and all the jogging has caused the knee issues that so many people get. And then there are, who knows if some of these aging issues have been escalated by their exposure. And whatever side effects they already were noted as suffering can be enhanced as they get older. The physical and the psychological issues. So where is their protection? Where is the treatment for first responders if we run out of funds? What if a New York City firefighter moves to Nebraska or Florida or whatever? Is any place out there really set up to care for that wonder? I call that person a wonder because God bless them from going in that direction on that day. But let me tell you this a different kind of story. I found a report that goes like this. You talk about needing to be prepared on the healthcare side. So here it goes. There was a 1.5 hour long shooting spree at a summer camp. It's a gathering of a political youth organization, people coming from all sorts of rural and urban areas, all sorts of folks. One gunman does this 1.5 hour long shooting spree, and at the end, 69 people are dead. 49, God help us, is bad enough. Then you get to 69 dead, plus many more injured as they tried to escape. And where did this spree take place? Not in England, not in the United States, not in Afghanistan. Where did this killing spree take place, and again is a terrorist attack because the guy didn't like how many people were moving into his nice, pristine place? Norway. And yes, from what I understand, they all look like nice, white, blonde, blue-eyed people. So you may stand out even more than you can here in the United States with the melting pot. I say that as a guesstimate, and I don't mean to offend anybody with it. But Norway, who expects terrorism for any reason in Norway? And I admit this was 2011, but I don't remember ever hearing this news. It just came up in an HBO clip last night on the CNN show hosted by Anderson Cooper as I was getting things prepped. And so hearing about this Norwegian terrorist attack, I looked it up, and here's the info that's important to the health experts, not traditional anti-terrorism experts. There were 495 survivors. A report comes from experts at 3 major facilities in Oslo, including the Norwegian Center for Violence and Traumatic Stress Studies. They surveyed a little more than half of the almost 500 survivors, and in 2016 a study was published on how well they were getting along. And guess what? It's not totally cheerful. 43% of survivors still had very high or truly high needs for psychological help. 17% noted they still had physical issues. Now, those are the stats that come from people who had true access to care. It's like walking into the Mayo Clinic or Hopkins or UCLA Medical or wherever, or any of the great outpatient, like patient first type facilities. But just like in the U.S., some of the survivors in Norway had health issues they couldn't really get addressed for whatever reason, their immigrant backgrounds, whether they were just afraid to come in or whether they didn't feel people could take care of them. Other survivors that were not admitted to the hospital and then later reported unmet needs for physical health problems more often. This is a report posted in Frontiers in Psychology, November 24, 2016. If you'd like the link, just contact me. I'll tell you how at the end of the show. Just put Norway study request in subject line, okay? And just to remind everybody, when we talk about terrorism, that health professionals and the healthcare system must be active in fighting and or treating terrorism, we have to define it better. On the website, futurity.org, which is apparently a compendium of information including audio and videos from leading universities, terrorism expert and professor at Stanford University, Martha Crenshaw, explained the difference between terrorism and mass shootings like the horror in Las Vegas in 2017. Professor Crenshaw said, and I quote, "When we talk about terrorism, we're talking about something that is an inherently political form of violence," end quote. And so she explained, since we didn't know the true motives of the Vegas shooter, she hesitated to call that terrorism. But if you look things up, and this is not from her, if you look things up, the blowing up of the FBI building at Columbine certainly qualifies as terrorism. It really doesn't matter, in my humble opinion, what it's called when it comes to, again, the health professionals. I mean, after all, think about what you folks really have to do. Couldn't it be the challenge of treating victims of places like the Pulse Bar shooting, the Pulse being a popular, well-established gay hangout? How about the angry kid who shot up the Florida high school, Marjorie Stoneman Douglas, because he'd been expelled? Does it and should it truly matter to those in healthcare if any kind of mass cow really fits the legal or political definition of terrorism, quote unquote? That's, to my state of mind, is not the issue. This is what launched this particular broadcast. I don't think that's what should be driving you. Of course, it should be your wonderful concept of recovery, of safety, of making life better, making lives better. So it's a screwiness. It really, and whether it's called terrorism, whatever else it's called, how well are the health professionals really trained? I did some more research, and I found it's related to